Next we'll be discussing nails. So if you see the structure of nails, our nails, they appear something like this. This visible portion of the nail, this is known as nail plate. In the proximal part of the nail, you will find this semicircular white area. This is known as lunula. And the skin which is present here, this is known as proximal nail fold. And on lateral side, the skin which is present on either side, this is lateral nail folds. And this thin rim of skin which is attached to the nail, this is known as cuticle. So these are the various structures like nail plate, then hemicercular white area, lunula, the skin which is present over the proximal part, that is proximal nail fold. On the lateral part, lateral nail folds, and the skin which is attached to the nail plate on the proximal part, that is cuticle. Now if you cut the nail and see the transverse section, it appears something like this. So you can see this visible portion, this is nail plate. Below nail plate is nail bed. Behind them is nail matrix. So this is nail matrix. Then these are two junctions, this junction and this junction. That is the distal junction where the skin is attaching to the nail plate, this is known as hyponychia. And this proximal junction which is where the skin is attaching to the nail plate, this is known as eponychia. So hypo because it is below the nail plate, apo because it is above the nail plate. Now these are few important points which you need to remember, like hyponychia, that is the distal junction where the skin is attaching to the nail plate which is below the nail plate. This hyponychia is the most common site for onychomycosis. So this is what? This is the most common site for onychomycosis. What is onychomycosis? Onycho means nails and mycosis means fungal infection. So whenever fungal infection occurs over nails, the most common site or the first site which is involved is hyponychia. Okay, so hyponychia is the most common site for onychomycosis. Then this visible portion of the nail plate, it develops from nail matrix. So this nail plate develops from behind, that is from the nail matrix. Infection of nail folds. So sometimes what happens, infection occurs in the nail folds, lateral nail folds or proximal nail folds. So this infection of nail folds is known as paronychia. Paronychia. Now this paronychia can be of two types: acute paronychia and chronic paronychia. Acute paronychia is generally bacterial, that is caused by Staph aureus, while chronic paronychia is generally mixed infection which can be due to bacterial as well as fungal. The fungal component commonly here is Candida. So remember that this is only due to bacterial, that is Staph aureus, while there after acute there can be chronic, and chronic is generally due to fungal, that is Candida, though some bacterial infection might also be there, so sometimes it can be mixed. So remember this: A acute, A aureus, C chronic, C Candida. I just now told you lunula, this is the hemicircular white portion which is present in the proximal part of the nail. So what is this? This is actually visible nail matrix. Now what does that mean, visible nail matrix? Let us try to understand this. As you can see here, this is nail matrix. Okay, so this whole portion is nail matrix, which is behind the nail plate, but there is a small extension of nail matrix which is going below the nail plate. So this extension of the nail matrix which is going below the nail plate is visible in the form of lunula. So lunula is nothing, it is that visible portion of the nail matrix which is present below the nail plate. Now there are few conditions where sometimes these small depressions are seen over the nail plate. These are known as pits or simply pitting. So why pitting occurs, or why pitting is seen over these nail plate, why these depressions are seen? This is due to defect in, or you can write down the defect also, that is, this is due to focal parakeratosis of proximal nail matrix. So pitting occurs due to focal parakeratosis of proximal nail matrix. Okay, let us try to understand this. Proximal and distal nail matrix. See, this is proximal and this is distal. Okay, so this is nail matrix, this is the proximal part and this is the distal part. I told you that nail matrix forms nail plate. Okay, so when the nail matrix forms the nail plate, this proximal part forms the dorsal portion of the nail plate. Okay, understood? So proximal is forming the dorsal part of the nail plate, while this distal portion forms the ventral part of the nail plate. Clear? So proximal part of the nail matrix is forming the dorsal part of the nail plate. The distal portion of the nail matrix is forming the ventral part of the nail plate. Okay. Now I told you that sometimes these small depressions are seen over the nail plate. Which part of the nail plate? Dorsal or ventral? Dorsal. And dorsal part of the nail plate is formed from proximal. So because the dorsal part is formed from the proximal, if there is some defect or pits present in the dorsal part, it is due to defect in which part of the nail matrix? Proximal or distal? Proximal. Okay, so now you understood that why we have written proximal here. Okay, so this is due to defect in proximal nail matrix because it is being shown on the dorsal part of the nail plate. Now what is the defect? The defect is focal parakeratosis. Focal means at places. Parakeratosis, if you recall, I told you what is parakeratosis? Retention of nucleus in stratum corneum. Okay, so when the proximal part of the nail matrix is forming the dorsal part of the nail plate, there are few areas, there are focal areas where there is retention of nucleus. Now because when the nail matrix was forming this nail plate, there were areas of nucleus which were left behind. There the mitotic activity is still present because nucleus is present. So because of nucleus, the mitotic activity is present, mitosis occurs, and due to mitosis these cells, they divide, proliferate, and they slough off. And when they slough off, what they leave behind? A small depression. So these small depressions of pit are due to focal parakeratosis of proximal nail matrix. I hope you understood this. Okay, so this is the reason for pitting. Okay, so sometimes if they ask you that pitting is due to defect in proximal or distal nail matrix, answer will be proximal nail matrix. So if this is the nail of the patient, you will find these multiple small depressions over the nail plate. Now seen in. So this is very important. Pitting is usually associated with psoriasis. The important point to remember here is that these pits which are seen in psoriasis, they are irregular and deep. So these are deep, coarse, irregular pits, and that's why it is also known as thimble pitting. Thimble pitting. Do you know what is thimble? Thimble is a metallic device which is used by weavers. They wear it over their thumb while weaving. Why? Because while weaving, the needle do not pierce their thumb. This metallic device is worn by the weavers. Okay, so if you look at that thimble, you will find a lot of depressions are present over them. Okay, so those depressions resemble the depressions which are seen over the nails of these patients. Okay, so thimble pitting is seen in psoriasis. Then alopecia areata. Alopecia areata. So in hair disorders, we have already discussed alopecia areata, and let me tell you that there is one nail change which is associated with alopecia areata, and that is pitting. So remember, in alopecia areata, nail change is also seen, and that is pitting. And this pitting of alopecia areata is regular and superficial. So very superficial and regular pits are seen. So this is known as geometric pitting. So thimble pitting is seen in psoriasis, geometric pitting is seen in alopecia areata. So let us consider this is the nail of a patient suffering from alopecia areata. You will find these regular geometric pits in alopecia areata. There is one more condition, eczema. In eczema also pitting might be associated. Okay, so no specific type of pitting, but just remember these are three important examples where pitting might be associated: psoriasis, alopecia areata, and eczema. Now there are few conditions where nail changes are very characteristic, and you should always remember, like nail changes associated with psoriasis. So nail changes associated with psoriasis are, one I already told you, pitting. And what is the reason for pitting? I told you it is due to defect in proximal nail matrix. So it is due to defect in nail matrix. Then another nail change which is associated with psoriasis is oil drop sign. Oil drop sign. Okay, let us consider that this is the nail of the patient. This is the nail bed. So in this patient who is suffering from psoriasis, you will find defect in the nail bed. And this defect in the nail bed appears as if a drop of oil is kept below the nail plate. So this is known as oil drop sign. Okay, so this is due to defect in nail bed. So defect is in the nail bed. Then third, this oil drop sign is also known as salmon patch. Then onycholysis. Onycho means nails, lysis means separation. So onycholysis. Sometimes what happens, this nail plate which is attached to the underlying nail bed, it starts separating. So onycholysis occurs. Okay, or sometimes there is destruction of the nail plate, and that's why this separation might be seen. Okay, now let us consider that our nails, they are intact, okay, and they are appearing pink in color. Okay, but if the nail plate starts separating from underlying nail bed, what will happen? This pink color will be lost and they appear white in color. This is known as leukonychia. So this is separation of the nail plate. This is a whitening of the nail plate. Leukonychia. Then subungual hyperkeratosis. Subungual hyperkeratosis. Okay, this is very obvious from the name itself. Sub means below. Ungual means nail plate. So what is below nail plate? Nail bed. So they are talking about nail bed. Subungual. Hyper means excessive, keratosis means keratinization. So there is excessive keratinization, hyperkeratosis, excessive keratinization where? Below the nail plate, that is in the nail bed. And when there is excessive keratinization, this nail bed will become thick. So this is nail bed thickening. So what is subungual keratosis? Subungual hyperkeratosis, which is seen in psoriasis, is nothing. It is thickening of the nail bed. Now let us consider that there is thickening of the nail bed. So when the nail bed is thickened, what happens? It is pushing the nail plate upwards. Okay. So when the nail plate is pushed upwards, what happens? This flat nail will appear like a tunnel, isn't it? Like the nail will appear something like this because of the thickened nail bed below, isn't it? So this is known as nail tunneling. So all these are the nail changes which are seen in psoriasis. Okay, so psoriasis presents with multiple nail changes. The first one which I told you is pitting. Pitting, also remember, is the most common nail change. So this is the most common nail change of psoriasis, pitting. Okay, then oil drop sign, also known as salmon patch. This is the most characteristic nail change of psoriasis. This is the most characteristic nail change of psoriasis. Other than these two, you will find onycholysis, that is separation of the nail plate, leukonychia, that is whitening of the nail plate, subungual hyperkeratosis, that is thickening of the nail bed, and nail tunneling, that is the nail takes the shape of a tunnel. The important point to remember here is that these four nail changes are not only seen in psoriasis, also seen in onychomycosis. Also seen in onychomycosis. So in onychomycosis also leukonychia occurs, onycholysis occurs, subungual hyperkeratosis occurs, and nail tunneling occurs. Just now I will explain that. Before that, remember these 6 nail changes of psoriasis, and if you find it difficult to remember, I am going to tell you a mnemonic here, and that mnemonic is nail polish. Simple, nail polish. Okay, so first is nail tunneling, P for pitting, O for oil drop sign along with onycholysis, L for leukonychia. This last SH is for subungual hyperkeratosis. Now only one alphabet is left, and that is I. So can you tell me what is for I? Remember, P is I. P is I means that this pitting is irregular, very characteristic. I told you regular pitting is seen in alopecia areata, irregular pitting is seen in psoriasis. Okay, so remember these changes, that is pitting, which is irregular, oil drop sign, then leukonychia, onycholysis, subungual hyperkeratosis, and nail tunneling. Now these last 4 nail changes are also seen in onychomycosis. But how to differentiate from psoriasis? Remember that this is due to fungal infection. Okay, so you can simply do one very simple thing, that is take KOH mount, and you will find fungus in the KOH mount. So you can very easily differentiate if you find both the changes, that is in psoriasis and onychomycosis, simply do KOH mount. Another change which is seen is in the nail tunneling. This question also came in one of the exams, and the question was that nail tunneling was seen in 2 finger and 1 toe nail. Which investigation should be advised to the patient? And one of the option was KOH mount, and the answer was KOH mount. Why this is a case of onychomycosis and not psoriasis? The reason is that only 2 finger and 1 toe nail is involved. Okay, psoriasis is a generalized condition. It might involve all the nails, but onychomycosis is generally localized to few nails. Okay, so remember this nail tunneling or these changes, if they are localized to few nails, then it is suggestive of onychomycosis. But if it is involving majority of the nails, then it is probably due to psoriasis. Okay, and also remember this nail tunneling is more specific of onychomycosis. Okay, so nail tunneling if seen, then it is suggestive of more of onychomycosis than psoriasis. Okay. So other nail changes also, remember how to differentiate. If you want to differentiate between psoriasis and onychomycosis, do KOH mount. Second thing is, if nail tunneling is present, then it is more suggestive of onychomycosis than psoriasis. And third is, if it is localized to few nails, it is probably onychomycosis. If it is involving most of the nails, then it is psoriasis. Then nail changes seen in lichen planus. So nail changes which are seen in lichen planus are also very important. The first and the most important nail change is pterygium. Pterygium. Now all of you might have read about pterygium in ophtha, isn't it? In ophtha you might have read that this wing-shaped encroachment which occurs is known as pterygium, but this pterygium is where? In the nails. So in lichen planus it is seen in the nails, and if this is the nail of the patient and this is the proximal nail fold, you will find that there is a wing-shaped extension of proximal nail fold which occur. So this wing-shaped extension of proximal nail fold which occurs is known as pterygium. Okay. Now when this extension of proximal nail fold occurs, what happens? It starts destroying the nail plate and it attaches itself to the underlying nail bed. So when it is attaching itself to the underlying nail bed and destroying the nail plate, if this is very severe and whole nail plate is destroyed, it might lead to anonychia. What is anonychia? Anonychia means absence of nail plate. So there might be absence of nail plate. Complete nail plate might be destroyed. So absence of nail plate might occur in lichen planus. Now let us consider this pterygium is going. It is attaching itself to the underlying nail bed, and the nail plate is being destroyed, and gradually it is being lifted in the central portion. Okay, so because this is going below it, it is lifting the nail plate. So there might be a patient which presents with lifted nail in the central portion. Okay, so the nail might appear something like this, like a tent. So this is known as pup tent sign. So nails might be lifted in the central portion looking like a tent. Then patient might develop onychorexia. Onychorexia is longitudinal ridging over nail plate. So such longitudinal ridging might be present over nail plate, onychorexia. Now remember that among these various nail change, the most characteristic nail change is pterygium. So pterygium is very important. This is the most characteristic nail change which is seen in onychomycosis in lichen planus. Then I already told you leukonychia. Next is leukonychia. See, leukonychia, I told you, it can be seen in psoriasis as well as onychomycosis, and that is whitening of the nail. Okay, but there are few examples of apparent leukonychia. Apparent leukonychia, I told you in psoriasis and onychomycosis what is happening, the nail plate is separating from the underlying nail bed, and that's why this pink color is lost, and that's why they are appearing white in color. But sometimes without separation the nail might appear white in color, then we call it apparent leukonychia. So it is appearing white, but it is not due to onycholysis, it is not due to separation. These are the examples of apparent leukonychia. First one is terry nails, half and half nails. Terry nails is seen in hepatic failure, also seen in congestive heart failure. Half and half nail is seen in chronic renal failure. Banded nails, also known as Muricki nails. This is seen in patients undergoing chemotherapy, also in patients suffering from hypoalbuminemia. Already these questions have been asked, so these are important. So terry nails, hepatic failure, congestive heart failure; half and half nail, chronic renal failure; and banded or Muricki nails in patients undergoing chemotherapy and patients suffering from hypoalbuminemia. Let us try to understand what is happening here. See, half and half nail is very obvious, isn't it? Let us consider this is the nail of the patient who is suffering from chronic renal failure. Since it is half and half nail and it is example of leukonychia, half nail will become white. Okay, so half and half nail and leukonychia. So half nail will become white. Now the question is, which half? Proximal half or distal half? Which half becomes white? Proximal half becomes white. Okay, and this is normal pink color. So you will find that in patient who is suffering from chronic renal failure, proximal half of the nail becomes white. If you forget this in examination hall, you can very easily recall this. Look at your thumbnail. Okay, the proximal part of the nail is already white because you can see lunula there, proximal semicircular area, that is white in color. Okay, so all of you will be carrying your thumb along with you in the examination hall, isn't it? So you can see there itself which portion is white, proximal portion is white. So here also proximal half becomes white. In terry nails again the same thing occurs, but most of the proximal portion becomes white. So if most of the proximal portion becomes white, this is terry nails. Here proximal half becomes white. And in banded nails, alternate bands of white color are seen. Alternate bands of white color are seen. So if alternate bands of white color are seen, then it is banded nails. So these are three examples of apparent leukonychia which you can remember. Then measlines, you might have read about this in forensic also. This occurs due to arsenic or thallium poisoning. Here also alternate discoloration is seen in the nails. Let us see few images related to nails. So here you can see this is the nail plate. This semicircular white area is lunula. This thin rim of skin which is attached to the nail, this is cuticle. This is proximal nail fold, and on either side this skin which is present, this is lateral nail fold. Okay, now you can see this white small area here. This is also leukonychia, but this is very common and many of you might be having this. So this is idiopathic leukonychia, which is normally seen, and as the nail grows it might pass off. Okay, so nothing to worry if you have this. This is an idiopathic example of leukonychia. Here you can see in the nail, patient is developing these small depressions. So this is the initial phase where these depressions are starting to be formed, but gradually you might find these multiple small depressions everywhere. Okay, so this is what? This is pitting. Then paronychia, I told you, it is infection of the nail fold. So you can see all this portion is nail fold. So here there is infection of the nail fold, and due to infection, what is happening? This is red. It is painful. There is swelling. So this red painful swelling which is developing in the nail fold, it is due to infection, and because all the acute inflammatory changes are there, this is acute paronychia. And acute paronychia is generally bacterial. I told you Staph aureus. So this is probably due to Staph aureus infection, and you can see collar, Robert, Dober. So all these three inflammatory changes might be present. So this is a case of paronychia. Then onycholysis. Here you can see this nail is perfectly normal, but here the nail is being destroyed in the distal portion, and if you see, this white portion is present. Why this is white portion? This is leukonychia due to separation of the nail plate from the underlying nail bed. So this is leukonychia due to onycholysis. Okay, this is seen in psoriasis as well as it might be present in onychomycosis as well. Then subungual hyperkeratosis is also a feature of psoriasis, and here you will find that the underlying nail bed is becoming very thick, and if you examine the nails you will find that there is a lot of thickening, and due to which the nails might appear yellowish in color. Okay, so lot of thickening is there beneath the nail plate, and due to which it appears yellowish in color. So this is the change which is seen in psoriasis, known as subungual hyperkeratosis. Then in onychomycosis, you will find that the nails are infected with the fungus, due to which there is onycholysis. Here also you will find that the nails are being separated from the underlying nail bed. Here also you will find that the nail is being destroyed, and along with the nails you will find that the surrounding skin is also having infection, due to which this scaling is present. Okay, and patient might have some predisposing factor like diabetes, and you might find these changes in the other nails also. So this is onychomycosis. This is a normal leukonychia. This is idiopathic normal leukonychia. Nothing to worry about this. Then Mees lines. These are again the transverse lines which are seen in the patient suffering from thallium or arsenic poisoning.